Yo, what up? This is my extra credit for Kines 345, sorry. Um, anyways, so this was a interesting podcast episode, and there's a few questions. So the what question, what is Professor Pellegrino's main claim about autonomy in healthcare? So he says that autonomy is important for patients in healthcare, but we shouldn't rely solely on autonomy. And basically, what that is just like, letting the patient decide what they want for their treatment. We should, give them a little bit of respect for that, but at the same time, don't just go into it blindly and only follow whatever the patient wants. Like, you actually have to, follow what treatment would be best for the patient. Now for the how question. So how does he prove his claim? What evidence, reasons, concepts does he use to prove his claim? So this he talks about virtue ethics. That's the concept or whatever. So basically, what that is the balance between respecting someone's autonomy and considering the patient's values and just hobbies and things and way of life. So respecting what their opinion is and what they would like to go with, but at the same time balancing it and making sure that you're actually doing a safe and effective treatment for the patient, if that makes sense. So that's what virtue ethics is basically about. It's just balancing, those two concepts. Anyways, now there's a so what question. So what? Why should we care about this claim? So it's important because you don't want to end up in a patient-doctor relationship where you're only going with whatever the patient wants, because then they might not ever get better. And you don't also want to be the other way around and only decide as the doctor what you want to do for your patient, because then you're just treating the patient like an object. So that's really it. So now there's a summary sentence where it wants me to fill in the blanks. Through the use of virtue ethics and examples of vulnerable patients, Professor Pellegrino argues that respecting autonomy is important, but doctors must use moral character to guide what's truly best for patients, which is important because it leads to ethical, compassionate, and balanced healthcare decisions.